So this was a 40 years old female. She presented in the OPD with shortness of breath, NYHA class 2, since long, almost around 1 year probably. And she has a palpitation, intermittent palpitations. So with this history, she presented, and this is the X-ray. She was a 40 years old young female. So this is the X-ray, and what we can see in the X-ray is this is the RV apex, and there is a enlargement of the main pulmonary artery. You can see concave, and you can see the right atrium enlargement. So there is a RV apex, RA enlargement, MPA enlarged with RV apex. So what are the differential diagnoses you could think of? Possibly most probable first differential diagnosis in this case with seeing this X-ray and the history would be probably idiopathic pulmonary arterial hypertension. Then second may place possibly a congenital heart disease like ASD, and then other differential diagnosis like chronic pulmonary thromboembolism. So with this, this is the ECG, and what are the findings in the ECG is you can see there is a right axis deviation. There is a P pulmonale suggestive of right atrial enlargement. There is a R by S ratio is more than 1, so suggestive of right ventricular hypertrophy. With strain pattern, you can see the T inversions in the V1, V2, V3, V4. So RVH with strain pattern with right axis deviation with incomplete RBB. So this possibly suggestive of there is a differential diagnosis with this 40 years of old female. You could think of idiopathic pulmonary arterial hypertension. The first diagnosis possibly this is RV pressure overload with stent pattern trees. So, and the second possibility is ostium secundum ASD. You can see the crochettage sign possibly in the inferior lead. So second possibility is the ACHD, ostium secundum ASD, with volume overload. After some time, if they develop the pulmonary arterial hypertension, then they'll get the RVH with pressure overload signs in the ECG. So, and the third possibility is the chronic thromboembolism, pulmonary thromboembolism. So these are the possibilities, and then there are pulmonary and with this, this is the echo. This is a 4-chamber view, and you can clearly see there is a RVH, RVA hypertrophy with RA enlargement. You can see the huge RA, then RV is the huge. This is a 4-chamber view, and clearly you can see the ASD is there with left to right flow. You can see how large is the this RA. There is a right atrial enlargement with RV free wall is almost around 15 to 17 mm. So you could see the RA size was 54, and this is a subcostal view, and the subcostal view you'll clearly confirm this is the ostium secundum ASD. This is you can see the same thing, and the size was almost, it was a big ASD with left right shunt. This is left to right shunt. You can see this is a PW over the ASD, and size was almost around 25 to 30. So this was a large OS ASD with severe pulmonary arterial hypertension. In this 40 years of age, she has presented this. So all REM, you can see all REM was adequate, but the thing is the patient was at the 40 years of age and with this severe pulmonary arterial hypertension with the severe RVH and everything, and still the flow is left to right, but it's very less like possibility of closure of this ASD. So we have started everything, all medications, and we'll do the right heart catheterization study, and we'll see possibly on echo there was severe pH. So I think there was very minimal chances. So this was the ostium secundum large ASD with